Hello and welcome. Today we'll be discussing adenocarcinoma affecting the urinary system, a serious type of cancer that can impact the kidneys, bladder, and other related structures. We'll break down what it is, how it develops, and the available options for treatment and management. The exact causes of adenocarcinoma in the urinary system are not always clear and often involve a complex interplay of factors. Certain risk factors have been identified. Smoking is a major contributor, especially in bladder adenocarcinoma. Exposure to certain chemicals, such as those used in the dye and rubber industries, can increase risk. Chronic inflammation, often due to long-term urinary tract infections or bladder stones, may also play a role. Genetic predispositions, while less common, can also contribute to increased likelihood. It's important to understand that having a risk factor doesn't guarantee developing the disease, but it does increase the likelihood. Adenocarcinoma develops when healthy cells in the urinary system undergo changes at the DNA level. These mutations lead to uncontrolled cell growth and division, forming a tumor. In the kidneys, this often begins in the renal tubules, which are responsible for filtering waste. In the bladder, adenocarcinoma can arise from glandular metaplasia, where normal bladder cells transform into glandular cells which then become cancerous. As the tumor grows, it can invade surrounding tissues, such as the kidney parenchyma, the bladder wall, or spread to nearby lymph nodes and other distant organs through metastasis. This invasion and spread disrupts normal organ function and can lead to a variety of symptoms. Epidemiologically, adenocarcinoma of the urinary system varies depending on the specific location. Renal cell carcinoma, the most common kidney cancer, has a significant prevalence worldwide, with higher rates observed in developed countries. Bladder adenocarcinoma is much less common than urothelial carcinoma, the predominant type of bladder cancer. The incidence of both types generally increases with age, with most diagnoses occurring in older adults. Men are often more affected than women, particularly with bladder adenocarcinoma, likely due to higher rates of smoking and occupational exposure. The signs and symptoms of adenocarcinoma in the urinary system can vary depending on the location and stage of the disease. Kidney adenocarcinoma may present with blood in the urine, persistent flank pain, a palpable mass in the abdomen, fatigue, unexplained weight loss, or persistent fever. Bladder adenocarcinoma can cause hematuria, or blood in the urine, frequent urination, urgency, pain during urination, or pelvic pain. It's important to note that these symptoms can also be caused by other, less serious conditions, but it's crucial to seek medical attention to rule out any potential concerns. Diagnosing adenocarcinoma of the urinary system typically involves a combination of approaches. A thorough physical examination and a review of the patient's medical history are essential. Urinalysis and blood tests can help detect abnormalities. Imaging techniques, such as CT scans, MRIs, and ultrasounds, are crucial for visualizing the kidneys, bladder, and surrounding structures to identify tumors and assess their size and location. A biopsy, where a tissue sample is taken and examined under a microscope, is the definitive method for confirming the diagnosis and determining the specific type and grade of adenocarcinoma. Adenocarcinomas of the urinary system can be further classified based on their specific characteristics and location. Renal cell carcinoma has several subtypes, including clear cell, papillary, and chromophobe, each with different genetic and clinical features. Bladder adenocarcinoma can be classified based on its histological features, such as signet ring cell carcinoma or urachal adenocarcinoma. These classifications help guide treatment decisions and predict prognosis. Treatment for adenocarcinoma of the urinary system depends on the stage of the disease, the patient's overall health, and the specific type of cancer. Surgical removal of the tumor is often the primary treatment option for localized disease. This may involve a partial or radical nephrectomy for kidney cancer, or a partial or radical cystectomy for bladder cancer. Radiation therapy and chemotherapy may be used to kill cancer cells, shrink tumors, or prevent recurrence. Immunotherapy, which boosts the body's immune system to fight cancer, is also an option for some patients. Targeted therapies, which specifically target cancer cells with certain genetic mutations, are another emerging treatment approach. While there's no guaranteed way to prevent adenocarcinoma of the urinary system, certain lifestyle modifications can reduce your risk. Quitting smoking is the most important step, as it significantly lowers the risk of bladder and kidney cancer. Avoiding exposure to known carcinogens, such as certain chemicals in the workplace, is also crucial. Maintaining a healthy weight, eating a balanced diet, and staying physically active can also contribute to overall health and potentially lower cancer risk. Prompt treatment of urinary tract infections and bladder stones may also help prevent chronic inflammation that could lead to cancer. The prognosis for adenocarcinoma of the urinary system varies widely depending on several factors, including the stage of the disease at diagnosis, the specific type of cancer, the patient's overall health, and the response to treatment. Early detection and treatment generally lead to better outcomes. Recent research is focused on developing new and more effective therapies, including targeted therapies and immunotherapies, to improve survival rates and quality of life for patients with advanced disease. Furthermore, research into early detection methods, such as biomarkers in urine, is ongoing to improve the chances of catching the disease at an earlier, more treatable stage. Thank you for joining us for this overview of adenocarcinoma of the urinary system.